network others as well. So again, thank you for joining. And then today's agenda for today's webinar, we are going to do an overview of the statewide learning collaborative that we hosted from 2019 into early 2020, to share key challenges that were surfaced through this process, highlight some promising initiatives and best practices and resources that we've heard about through the process or have developed, as well as introduce statewide efforts emerging because of the learning collaborative and other stakeholder efforts. And we will leave some time for some interaction and connection making at the end, as well as time for questions and discussions throughout. So I would encourage you to use the chat feature on the side toolbar along the way if you have any questions. My colleagues, Catherine and Fasong here from ITHI, will also be monitoring the chat box, can answer questions, and will be helping to lead us through part of today's presentation. So I'm going to go ahead and turn off my camera so I can focus on the slides. And hopefully, if anyone's having audio problems, hopefully you'll get those resolved, and Catherine and Fasong can help you in the chat box as well. So some brief background before we get started. We here at the Illinois Public Health Institute were lucky enough to receive a 5-year cooperative agreement from the Centers for Disease Control and Prevention called the State Physical Activity and Nutrition Program. It's a $4.6 million initiative over 5 years meant to help implement physical activity and nutrition interventions across Illinois. We are focusing on 3 main geographies for sort of geographic specific work, but we are doing statewide strategies as well. And just a reminder, if you can please mute yourself if you are not speaking. We might have to mute everyone if we see problems, but hopefully my colleagues can help with that. So we are focusing on communities hardest hit by chronic diseases like type 2 diabetes and heart disease. And while the Illinois Public Health Institute is the main grantee, we are working in collaboration with a whole bunch of partners across the state. Many of them you'll see on this next screen, and we are working very closely with the State Department of Public Health as well. So these are many of our partners who are helping us implement this grant across the state. And the grant has us working in 4 key strategy areas, which you can see on the screen here. So breastfeeding is one of them, which we'll talk in depth about today. But we are also looking at integrating nutrition and physical activity into the early childhood education system across the state, connecting and improving physical activity through connecting activity-friendly routes to everyday destinations, improving walking, biking, and transit options for folks that promote physical activity, and implementing food service guidelines. Here, Fasong or Catherine, can you please mute everyone on the line other than me for now?
Hi, Jan, they're muted.
All right, there we go. Thanks, everyone. So we have been we're closing up on year 2 of this project. We call it ISPAN for short. And so we wanted to tell you a little bit about our work in the breastfeeding area. And our work is really focused on improving the continuity of care. So really the connections between various institutions, supporters, stakeholders, so that a family who's breastfeeding's journey from prenatal through delivery through postpartum has a continuous set of support systems, messages, and materials for that family, and that they receive support for the full continuity spectrum. So we're doing this in our 3 geographies. So those geographies are Chicago and Cook County, Jackson County in Southern Illinois, and the Peoria, Tazewell, Woodford, Tri-County region in Central Illinois. We're really focusing on some local work in those 3 regions. And we also are doing the statewide learning collaborative. So we launched that collaborative in early 2019 and it spanned over the course of the year, and we'll tell you more about that. But what it consisted of was the majority of the WIC regional breastfeeding task forces that exist in Illinois. So these are regional groups centered around WIC offices in those regions, but with many other stakeholders as well, working together to support breastfeeding in those regions. And we are also have done a lot of planning and stakeholder engagement in these first couple of years. While the Illinois Public Health Institute has a lot of experience in capacity development and systems and policy change and nutrition experience, we're a little bit newer to the breastfeeding field, and so it was really critical to engage all of the organizations and stakeholders who have been working on breastfeeding support for the many years before we got this grant. We did a landscape scan early on. We held 7 focus groups with moms who were in our priority populations. Last year, we had a set of community advisors, so real moms in Illinois, joining us to help us think through our strategy, and we had several strategic planning meetings. And all of that helped us create a framework for how we wanted to spend our money and time with this grant for Illinois. And that framework lays out this goal and vision. You can read those on your own, but really, again, focusing on continuity of care, improving links between hospitals, primary care, women, infant, and children clinics and services, early care and education, work sites, other social and community programs and services. And again, those priority populations for us are low-income communities, rural communities, and communities of color, specifically African American and or Latinx communities for breastfeeding. And we did create 3 objectives for this work for the remaining part of our 5-year grant. One of the things really sort of, I think, coming from our performance measures, even with the grant, is we really want to look at increasing the number of places that are supportive of breastfeeding. So more work sites, more child care centers, more primary care sites, more hospitals that have breastfeeding friendly practices is something that's really a main goal of ours. And then we also added these other 2. So by the end of the grant, we're hoping that moms in our priority population have increased access to lactation support professionals, whether they be internationally board certified lactation consultants or CLCs or CLSs or peer counselors, but somebody who can support them in lactation with specific lactation training, who has similar lived experiences as them. So this was really important part of our discussion, was really trying to think about having people with similar backgrounds and similar lived experiences being there to support them and having the skills they need to support lactation. And finally, the 3rd objective is that by the end of the grant, our priority populations will have increased access to accurate and culturally relevant information that they need to support breastfeeding. So we did hear this in our focus groups and a variety of other stakeholder discussions, that making sure not just information is there, but it's accurate, that there's consistent messages, it's culturally relevant, and representative of all of our populations across the state. So that's the work of the first couple of years and our framework for moving this grant forward. And now I will dig in a little bit more into the Learning Collaborative specifically. So we held this Learning Collaborative. Again, this was with the 7 of the regional breastfeeding task forces that were already in existence in Illinois. And you can see those listed at the top. So we had Central Illinois, Champaign, Chicago, Edwardsville, North Central Illinois, Northern Illinois, and Southern Illinois task forces were all involved. In the early part of the Learning Collaborative, we did an environmental scan. And I will say this work couldn't have happened without our consultants at Aim and Arrow Group, Annette Charles and Devi Raja. So thank you to them. And we did the environmental scan that looked at existing work, gaps, resources, both in Illinois and across the country. Then we did a little bit of a discovery phase where we helped to identify community needs and gaps and talk to stakeholders. And this included those focus groups and input from moms and families. And then we had the Learning Collaborative meetings where we really focused in on skill building and best practice sharing across the task forces. We asked each task force to create an action plan for how to improve breastfeeding continuity of care in their regions. And then they are now all actually working on those plans, albeit with some modifications because of the COVID pandemic. And so that was our journey for the course of the year. And you can see we did some overview of best practices at the beginning. We did a training on human-centered design, which is really focused on making sure we're shaping our actions and our plans around the person experience, what they're experiencing, what they're needing, and how that works best for them. We worked with various providers. We provided the focus group findings, some action planning best practices and tools, and then we did sharing, lots of peer sharing along the way. So 3 of our key Learning Collaborative learnings, if you will, are on the screen here. We will dive into each of these. So the first one is that there are pervasive challenges that are being echoed across the state to improving continuity of care and support for breastfeeding. And you'll see those common challenges in the next several slides. But a lot of people are facing similar challenges. But we also found that relatively small investments at the community level can garner great results in reaching and impacting moms and those people who influence and support moms. And finally, we found that there is a need for some more statewide coordination to maximize the impact of the community efforts, many of which are already underway. But more coordination across some communities and across the state will really help maximize the impact everyone is working to create. So I'm going to go ahead and turn it over to my colleague, Catherine, who will go through the next several slides focused on the first challenge, and then turn it back over to me. So go ahead, Catherine.
Great, thank you so much, Jana. So as Jana mentioned, one of the key learnings that came out of this process for us is that there are pervasive and often common challenges that are experienced by people working to improve breastfeeding support across Illinois. So we'll go ahead now and dive into what some of those were. So these are 5 challenges that we heard across the state. The first is maximizing impact despite limited resources. The second was a challenge related to partnering with healthcare in order to create consistent messaging and continuity of care. The third was incorporating and maximizing the potential of technology. The fourth was building support within workplaces and within communities. And then the fifth was developing new capacity and financial resources. So I'll go ahead and show you a few examples of what these challenges looked like from both the perspective of task force members and also from moms in the focus groups that we hosted. And I think you'll notice that there are some commonalities. So this first one you're seeing on the screen was maximizing impact despite limited resources. The speech bubbles on the screen are quotes from our task force member participants, and then the green box has a quote from a mom from our focus groups. So one learning collaborative participant highlighted that limited resources can be especially pronounced in rural areas. And then a focus group participant talked about how there's need for both increased awareness of existing resources and additional community-based resources as well. So our second challenge was partnering with healthcare in order to create consistent messaging and continuity of care. A learning collaborative participant emphasized the need to collaborate more with healthcare entities and with providers. And then on the patient side of that equation, a focus group participant shared that she didn't learn anything about breastfeeding from her medical provider and that she was left feeling in the dark. Our third challenge was incorporating and maximizing the potential of technology. So one of our learning collaborative participants talked about the benefit of using technology such as texting, but needing to do it in a HIPAA compliant way, and that being a potential barrier to using that resource. A focus group participant mentioned needing to see more breastfeeding support and promotion through social media. Our fourth challenge was building support within workplaces and within communities. So a learning collaborative participant spotlighted the cultural barriers that this work faces, especially around breastfeeding duration. And then a focus group participant also underscored this cultural barrier. As you can see, she mentioned being expected to feed her child in a bathroom. So then finally, our last challenge that we have noted is developing new capacity and financial resources. So a learning collaborative participant expressed the need for new lactation support providers who are more representative of the communities that they serve. And a focus group participant emphasized the same. She wants information from people who look like her. So we found that the breastfeeding support challenges that emerged from the Learning Collaborative were reiterated from several sources, including the focus groups as you saw, but also from our partners and from other advocates in this space, and from the landscape scan that Jana mentioned at the beginning of the presentation. So with that, I'll go ahead and turn it back over to Jana to talk about our next learning.
Great, thank you, Catherine. So the next part was really that a very small investment at the community level is really can garner really great reach and impact. And we saw this really through the action plans that these groups were creating. And many of these task force members have been working together for a long time. But in some instances, this was the first time they created this collective action plan in a very specific way. And we are now seeing the results of some of those things. So this is a summary of what the 7 task forces put together. And I'm going to go through a few of them quickly, but they range from prenatal education, having that at providers and family levels in North Central Illinois, to really focusing in on the breastfeeding supports provided by the WIC office like having peer counselors within hospitals immediately following delivery, to postpartum support, so supporting moms by attending peer support groups and other things like that. So these are a subset of the sites we've been working with to make changes again. So we have, again, in the ISPAN strategy, multiple places where we're working, but these were some of the initial action planning improvements that are being made. In Central Illinois, they're creating a lot of different changes between the health department to birthing hospitals, federally qualified health centers, and the other sort of private lactation stakeholders in the area. And through that part of our grant, they've been making a whole bunch of changes. Good job to the PRM Central Illinois team and all that they've done. And as part of this specific initiative, they're working on really creating a toolbox for social media for moms to support them in their journey, to complement all the other work they're doing in their area. Again, in Champaign, communicating with hospitals and having their WIC staff, breastfeeding support staff, attending to moms after birth. They're definitely working in one hospital now and going for a second soon. In Chicago, working to update some policy work at St. Bernard Hospital, as well as creating a new milk bank depot in the community and getting a trained peer counselor on site as well. In Northern Illinois, getting some printed materials to prenatal providers to distribute to families. Sorry, in North Central Illinois, Lake County. Edwardsville, we're going to hear from in just a minute. In Northern Illinois, giving some incentives to moms who attend multiple support groups and having them have some added support in that way. And in Southern Illinois, creating a breastfeeding-friendly business recognition program that they're going to expand across up to 25 counties in the region. And what you can see from some of these action plans is the potential reach is 2,200 people across 39 sites if these action plans created in the Learning Collaborative come to full fruition. And again, with the COVID-19 pandemic, things have been paused in some cases, but women are still delivering and having babies, and breastfeeding support is still needed, so a lot of the work does continue. So I'm going to go ahead and turn it over to Bhaga Kohli, who's with us. She is the Director of Nutrition Services at the Eastside Health District, and she is going to talk a little bit about the work that they did in Edwardsville with their action plan. So Bhaga, go ahead.
Hi, good afternoon. I have been working with the Edwardsville Breastfeeding Task Force for the last almost 20 years. And our task force covers the Bond County, Jersey County, Madison, Macoupin, Monroe, Randolph, and St. Clair. And Eastside Health District, who I work for, I'm the WIC director with oversees the breastfeeding program. We are in St. Clair County. One of the things what we came up as far as the action plan for this collaborative was we identified about 3 things. One is that breastfeeding, you don't see positive breastfeeding messages in the OB offices, in the exam rooms. Sometimes we have noticed that there are cans of formula sitting in the exam rooms, and so we thought we could have like nice posters. So we took pictures of breastfeeding moms and along with doctors, and we had a caption for those pictures, called it Breastfeeding Baby Tested, Doctor Approved. And we created over 200 posters with these pictures and in picture frames. And we are planning to display them in the OB offices in our area. So moms, when they go to the doctor's office, they can see this positive breastfeeding message. The other thing what we found out was the continuity of care was also an issue with our breastfeeding moms. All pediatricians and OB offices did not have enough breastfeeding resources available for their moms. And most of the time, our moms value the doctor's opinion a lot. So we thought, why don't we talk to the pediatricians' offices and equip them with more resources so that our moms could have continuity of care. So what we decided was we'll evaluate the level of breastfeeding support, what the moms are receiving and what gaps there were. So we wanted also to inform them that WIC is the go-to place for breastfeeding support help for the low-income families. And if there's something we could do to help the doctor's offices, bridge this gap. So our breastfeeding peer counselors took it as an outreach project and visited 21 doctors' offices over the period of 2 months. And they gathered information on the breastfeeding support practices provided. And some of the information we gathered was what kind of support they offered, and were the moms where do they refer their moms to breastfeeding support, and what do they have any breastfeeding policies? Do staff routinely receive any breastfeeding training? Do they offer breast pumps? And do they have enough breastfeeding resources for the mom and staff? Do they need more information? And also if they have a breastfeeding expert in their office, and were they interested in making their office a breastfeeding friendly place? Would they like to receive updates and resources, or would they like an in-service from our staff? And if they knew if WIC was the go-to place for breastfeeding. So we were very surprised that this was a very positive response we had received. And we found out that about 1/3 of the offices did have a breastfeeding policy, and only about maybe little over 10% received breastfeeding training annually, the nurses and the office staff. And over 50% of the offices said that they referred their moms to the delivering hospital for any help with breastfeeding. But surprising was about 75% of them offered the breast pumps in their office for the moms, but there were no breastfeeding experts in the office to help them through all these things. And over 85% of these offices said that they would like more information on breastfeeding, and very few knew that WIC was the go-to place for breastfeeding support for our low-income moms. And some of them did actually, almost half of them said they would not mind an in-service from us to their staff. So that is something we want to continue to build and see maybe we could provide ongoing support to these doctors' offices. And we gave them a packet of resources when we went there. Of course, our breastfeeding peer counselor brochure, we had WIC program information, the breast pump prescription sheet, our breastfeeding task force resource guide. This resource guide has a lot of breastfeeding support places in the St. Clair County around and supporting areas where moms can go for breastfeeding, private practices, doctors' offices, or the hospitals, or WIC agencies. Any of those resources we have listed, so we shared that with them. And we also gave a breastfeeding assessment checklist, does this mom need to get further support or not, or is she doing well, kind of a thing. And we gave some handouts from the Illinois WIC program, has plenty of breastfeeding handouts, and so we shared with those also with them. And they were very happy about that. And the outcomes, what we found out was that there was increased awareness among the staff of the healthcare facilities about breastfeeding support, what is available out in the community. And the second thing was we had great relationship building between our staff and the providers. And so our staff knew who to call when they called this doctor's office. Oh, I know this nurse. This is the person I met. And they took their phone numbers and the contact names. And so it's easier for us to communicate. And the nurse also felt comfortable communicating with my staff because they've met them in person. And we have noticed an increase in referrals for breastfeeding support. And so by then we've increased the continuity of care for these programs. And on the slide you're seeing, that is a sample of our breastfeeding poster, what we had created, which we would be posting them in the doctor's offices. We're going to put them in picture frames. The posters are about 11 by 17 size. And so we've got very diverse moms and babies, as well as the doctors, people who pose as the doctors for the pictures. And so with all this, we found that it was the communications with the doctor's offices was very, very important. And it definitely increased the awareness that we exist and we provide the support. And also they're seeking for some training themselves. And that was very eye-opening for us.
Great, thank you, Bhagya. We really appreciate this. It's a great story, and you guys really have done a lot of work to build this relationship. So congratulations, and hopefully we can continue to see the outcomes and impact from this. Great. So just to tell you all a little bit about some of the stuff going on and things we've collected. We have been doing some systems level resource gathering, if you will, for this grant. And so we have tried to pull together all of the curriculums and strategies that we have seen both in Illinois and through our work, but also across the country. So we are pulling together those various things. We have a site-specific strategy resource document that we can send and share with folks. And it really looks at what different types of sites, whether it's a hospital or a clinic or a work site or an early care and education site, can do to help improve continuity of care in a concrete way. And then, of course, there's nationally renowned curriculums like Ready, Set, Baby and the Centering Pregnancy Model that are also resources available for folks. And we also have been collecting various social media toolkits. There's some great videos out of other coalitions across the country. And one thing we heard from each of our Learning Collaborative task forces as we were wrapping up the Learning Collaborative, there was a strong desire, this was at the beginning of the pandemic when we were closing out the Learning Collaborative, a strong desire to get moms virtual support as quickly as possible. And many folks were figuring out telehealth, there was an idea to collaborate around creating a video series for social media. And so we've had, I think, over 17 videos now created by lactation experts across Illinois from all of our regions on various tips to support breastfeeding. So if you, I wonder if we could put the playlist in the chat box as well. So
we'll put it in there now.
Great. So we've created several support videos. Their lengths are about 1 to 3 minutes long, from everything from basic positioning and techniques for ensuring you have a good latch to things like how to eat healthy at home while breastfeeding, to how to look for a child care provider that supports breastfeeding, and a whole bunch of things. So that link is now in the chat box as well if you want to check out those videos. And we have a couple more coming soon. We also have been compiling the various trainings that are out there. We know the American Academy of Pediatrics, including our local Illinois chapter, has continuing education online opportunities around breastfeeding. There's been a lot of talk across the country on making sure we incorporate information about implicit bias and the impact on lactation support. And so we've been compiling those thanks to also ASTO, the Association of State and Territory Health Officials, doing that work at a national level. And finally, we've been trying to continue various connections in Illinois. So we've created an Illinois Breastfeeding Care and Support Google group, which includes a sort of a listserv, if you will. It includes everyone who's participated in our grant so far, including those task force members that are part of the Learning Collaborative and several other stakeholders. If you're interested in getting on that, you can send us a note. And then also the regional task force work obviously continues. So if you want to get in touch or connect to any of this work, please do email us. We will, and we're going to have a chance at the end of this webinar for you to share how you're interested in this in a Google Sheet. But my email is at the bottom of the screen for folks who think you have something specific that you'd like to connect to. And I will say, if anyone has any questions for Bhagya, you can put them in the chat box and we will be sure we have time at the end. And so the final key learning we wanted to share today is the need for some more statewide coordination to maximize the impact of community efforts. Again, several of those community efforts are underway, but some more coordination across them can help maximize their impact. So building on all of these conversations, these are some things we are doing here in the grant to help support this. We are creating a statewide communications campaign, really focusing in on the resources available to help moms and families breastfeed. When we've done a scan of what's out there, a lot of it is basic information about the benefits of breastfeeding, basic latch, positioning, things like that. But there's not a lot about what do you do when you hit a roadblock? What do you do when you're struggling? Who do you go to? What's out there? Who is there in Illinois? And so we are creating a communications campaign with posters and palm cards and social media content to help advertise some of those resources in Illinois that are available. There's an Illinois Women's Health line that has a link to a certified lactation consultant, which many people may not know about. We are going to compile these resources onto our IPHI breastfeeding webpage. We are going to create these posters for waiting rooms and palm cards that highlight home visitors as support, WIC, lactation consultants, doctors and pediatricians, and a whole bunch of other folks in these campaigns. We have also been trying to offer a lot of training opportunities for people of color to become breastfeeding support professionals. So there have been some other funding sources, and some of this grant funding we've used to host peer counselor trainings. We are paying for folks to go through CLC and CLS trainings. And then our first year, we also paid for folks to go through the IVCLC training. So we are really helping to increase the lactation support professional field here in Illinois with people who have similar lived experiences as priority populations and with people of color to get a more representative group of professionals in the state. We are trying to include implicit bias and racial equity lenses in some of the professional development work that we know is going on. So we are in the midst of creating a toolkit, which will include some basic slides and discussion questions and things that folks can use and incorporate into other trainings or meetings they're having on lactation support. We've explored some policy issues that have surfaced around funding and reimbursement policies for breastfeeding and lactation, as well as the workforce and workforce development issues. And there are lots of partners we have involved leading those ways. And we are going to continue, of course, to support institutions in making changes to their policies, processes, and procedures to improve support for breastfeeding through these learning collaboratives, through direct technical assistance, and through many grants to those institutions. On for a little bit longer and then conclude the webinar. So please go to enter questions. Give everyone one more minute if you have a question to get into the chat box, and then otherwise we will conclude. Someone's looking for a handout on education for nutrition for lactating mothers. Not being able to find a good handout for that. So yes, that's something we can connect you to. And others, it looks like you want to connect with us afterwards. So that's great. Yes, we're happy to connect with anyone who's on here who'd like to connect afterwards to get any of these resources we've come across, the posters or social media we've created, or otherwise get connected with the stakeholders and partners in various regions. We are happy to do that. All righty. Well, thank you again so much for joining today's webinar. We hope we will have future webinars to continue sharing learnings and outcomes of the work we are doing through this grant over the next 3 more years. And so we appreciate your time and effort. And again, this has been recorded, so we will share the recording out with folks if you want to share this information with other audiences as well. So thank you so much and have a great rest of your day, and happy National Breastfeeding Month. Thank you.